Let us have our seats. You know, it is always very, very difficult to speak after Kuria because he mixes politics with serious business. The Cabinet Secretary, Minister of Health, my sister, Honorable Susan Wafula, the Cabinet Secretary in charge of Public Service, Performance and Delivery Management, Principal Secretary is present, led by Mary Mudhoni, Kimtai, and Dr. Rono, and Madam Veronica Nduva. The Deputy Governor of Kericho County, the Chairman of the Health Committee of the Senate, Mheshimiwa Madago, members of Parliament that are present, development partners present, senior government officials present, members of the county assemblies present, and most importantly, the health care workers here today. Ladies and gentlemen, good afternoon. I'm most pleased to join you all for the first of its kind National Human Resources for Health Dialogue. Today's session is the culmination of consultations that began at the Windsor Cove and County Club from 5th to 7th October 2023 on the subject of the coordination of the regulation of all health cadres, as well as those held on 11th to 12th October 2023 at the same venue. Those very inclusive and enlightening discussions will inform part of our dialogue today. Ladies and gentlemen, therefore, I extend a special acknowledgement to the diverse assembly of healthcare professionals in attendance today. Their participation and invaluable contributions are indispensable to this discourse. To all the health workers and all stakeholders, I salute you for standing to be counted at this historic ground of Kapkatet ground in Kericho County. We stand at a moment of exceptional possibility. This is a moment when the dream of universal health coverage that has been elusive from the dawn of the Republic is now attainable and within our reach. This is a moment also when the lessons learned from the COVID-19 pandemic and the unprecedented magnitude of the devastation it left in its wake are inspiring a new approach to our nation's healthcare. We must seize the moment. Since health is a shared function between the two levels of government, the two tiers of government are therefore jointly summoned to formulate strategies that guarantee the provision of secure, effective, and high-quality healthcare services. Ladies and gentlemen, I want to say to all the doctors, clinical officers, nurses, and all other health workers across our nation, as I speak to their representative with us today, you are seen, heard, valued, appreciated, and respected. Every day you go out into your workplaces, driven by a passion to heal, a desire to make lives better, and your hearts and mind solely focused on making Kenya a healthy nation, one patient at a time. And for that, on behalf of the eternally grateful nation, we say, Asanteni sana na sana. Our thanks as a nation must extend beyond mere words. Our gratitude must be manifested in us, building a robust healthcare system that is characterized by a well-trained and well-motivated human resource, well-equipped facilities, well-stocked pharmacies, and well-thought-out policies and strategies fit for the challenges of the 21st century healthcare. We must do this because health is the well from which we water our national prosperity, happiness, and our dreams of a better Kenya for all. Today, we shall take cognizance of the multifaceted challenges faced by healthcare workers at both the national and the county levels. These challenges encompass, firstly, the question of staff mobility, what has come to be known as labor migration. Chiefly, the fact that once you are employed by one county government, you can only move to the next county if you resign. The second challenge is training, retooling, and personal development. The third is staff welfare and career advancement. The fourth is performance management and motivation. And the fifth is healthcare worker safety and well-being. It is incumbent upon us to collectively identify the most pragmatic solutions to address these and other challenges. And what better avenue to achieve this than through sustained dialogue? I am persuaded that this historic apartheid ground will make history yet again as the place where lasting solutions to the human resources challenges facing health in Kenya fight and the commitment to their resolutions began. The landscape of Kenya's healthcare sector is not wanting for policies and institutions to guide and support the human resources for health. However, our government has swiftly recognized the inherent risks posed by the absence of a central coordinating mechanism to harmonize policies and strategies that pertain to various facets of human resources for health. We have recognized the futility of conceiving additional policies in the absence of an institutional framework that evaluates existing policies and offers guidance on the most prudent course of action, which may often involve enhancing the operationalization of the existing policies and fostering coordination among existing solutions. Distinguished delegates, this realization prompted the national and the county governments to establish the Kenya Health Human Resource Advisory Council. While instituted under the Health Act of 2017, the governing council of this council had then not been constituted. During the promulgation of the Act, a situation that created a void in the coordination of the human resources, health resources related matters. Our swift constitution of KHRAC, conducted in close consultation with the Council of Governors, exemplifies the government's unwavering commitment to offering sustainable solutions to the long-standing challenges affecting the health sector. I extend my profound appreciation to the leadership of the Council of Governors for their prompt and wholehearted commitment to working alongside us in the operationalization of the Council. We are confident that the Council will play a pivotal role in refining the training, development, and management of our healthcare workforce. Ladies and gentlemen, today we are privileged to listen to the voices of our healthcare professionals, those responsible for their training and oversight, and those tasked with providing policy direction regarding human resources. I want to thank my assistant, the Cabinet Secretary for Health, who has painstakingly endeavored to ensure that the dialogue in this area shines a spotlight on the experiences of healthcare workers, and that we, the custodians of public service, listen to their voices in vibrant dialogue. Congratulations, my sister. You've worked very hard. So the ultimate objective of this dialogue, and especially today's outputs, is to formulate specific action points and realistic timelines for the implementation of critical initiatives aimed at enhancing the status of our healthcare workforce. The government of Kenya, under the leadership of His Excellency the President, remains steadfast in its commitment to fortifying human resources for health. We also recognize that this endeavor in isolation is insufficient. We are concurrently engaged in fortifying other pillars of our health system, such as health products and technologies. This is the reason why His Excellency the President launched the Local Manufacturing Expo last week on Friday, and also the reason why Cabinet directed KEMSA to give locally manufactured pharmaceutical products preference over imports. These and other actions are in keeping with the administration's plans to bolster local manufacturing, promote the digital health ecosystem, and increase healthcare financing. These facets must align harmoniously to facilitate effective delivery of the much-awaited universal health coverage. We currently have 4 pivotal draft bills meticulously tailored to expedite the achievement of universal health coverage. These include the Social Health Insurance Bill, the Primary Health Bill 2023, the Facility Improvement Financing Bill, and the Digital Health Bill 2023. We extend our gratitude to the honorable members of the Parliament in both the Senate and the National Assembly for their steadfast commitment to expediting the deliberation and passing these essential bills. Ladies and gentlemen, having excellent health policies will count for nothing if they are not carried out well. It is critical that we collect good data on our healthcare workers to see if our plans are working. I have been informed that in the region, Kenya leads in effectively implementing the WHO-supported National Health Workforce Accounts, a measure that enhances the accuracy and the utilization of health workforce data, and which helps us measure the impact of efforts to improve human resource management. Going forward, we will have a clearer understanding of essential health workforce data, including employment, retention, and attrition levels. Both levels of government are faced and continue to face challenges in health worker staffing and deployment. The answer is to deploy a bottom-up approach of listening to everyone in the health ecosystem. From the voices that we have heard thus far, we must adopt the workload indicators of staffing needs approach, which allows us to base healthcare facility staffing on actual workloads and stress assessment, a move focused on prioritizing the well-being of our healthcare workers. As I conclude, I want to echo and congratulate the Minister of Health for being in the forefront in trying to fast-track the primary healthcare strategy. It is the only way we can even cut down on the expenses in our healthcare environment, because prevention is always said better than cure. And all over the world, all of us have gone across the world. You realize that curative stage, you realize there are very few people, and even the expenses are not as much as the money that has been allocated to primary health care. Many years ago, when we were in secondary schools, we were taught about prevention. We were moving from one household to another one, constructing toilets ourselves, from one home to another one, constructing toilets, going from one home to another one, trying to teach them the little knowledge that we were taught in our primary schools on how important it is even to wash your hands from that toilet, and even to wash again when you are setting yourself to eat your food. We were even told, even to be careful. Greeting is okay, good, it's African, but be very careful, because sometimes you can greet some people that can infect you with very dangerous diseases. And we were very careful also. Whenever we see somebody who is not bathing very well, who is not clean enough, you just wave and run away because you knew for sure you'll end up forcing your family, your father, your mother to sell a goat or a cow to take you to hospital. So the best thing is avoid greeting him, face the community's blame that kijana ya mzee fulani ameringa siku hizi kwa sababu ameenda secondary, lakini umejikinga na ugonjwa. And of course, we are in a good space. We are in a space where Moses Kuria said our minds are meeting. From the unionists, from professionals, from the government, all of us, from the development partners, all of us are speaking the same thing. And that thing is a conversation on issues. Issues that are geared to bringing solutions on the table. And as government, we are happy about the space. This space that we have established in this country by this administration will see us going far, not only in health sector, even across the sectors in the country, because each and every citizen of this country now is feeling and enjoying public participation as is provided for in the Constitution. We are happy about that, and we are going to take whatever you tell us, whatever conversation, whatever information you submit before us here very seriously. And that is why your cabinet secretary in this sector has been busy taking notes, because she wants to go and structure her strategy in line with the needs or the requirements of the people. And we are very happy that all of us are candid, and we are very, very well advised. Ladies and gentlemen, we have come a long way. You see, as a professional, and if you can remember, I know there are people who are elderly here who have been in healthcare sector. You remember those days when a nurse was in a uniform. She used not to pay matatu fare. She used not to queue. She used even not to queue even in supermarkets, because everybody respected and they knew that this nurse perhaps is in a hurry to go and save a life. They were always there was a giving way. You give way when you see a doctor, when you see a nurse. But what has happened now? And that is what we need to discuss. Why is it that this critical and very, very, I can say, a very obligatory situation and a sector that we know it makes a whole difference between life and death are not treated the way they were before? Why are we the same? Why is it that nowadays an ambulance is blocked by people? They don't care. I want you people to ask yourself. And you can see, simply put, it is because even those who are in that profession have not kept the profession high. They have lowered their guard, and they have become ordinary like anybody else. You get them in all manner of cases, arguments, fighting in the bars, being arrested because of theft. So nobody, as we speak, cares whether you are a doctor, whether you are a nurse, whether you are a health professional. They don't care when you are queuing on the same panga line, because they know you may be hurrying to go and kill somebody. No treating. And all things, ladies and gentlemen, is the decay of our value system. We need to ask ourselves, how do we turn around? As much as the government is creating an enabling environment, as much as all of us are agreeing that we need to take a particular trajectory, can we see our morals? Can we see our social space? How are we going to return back the profession that we knew and that we know back to where it was? It is a question to you people. Go and think about it. No matter how much we pay a salary, no matter equipment and facilities and commodities are provided, if we don't live true to the profession that we have been called into, because medical world, medical field is not about employment. It is a calling because you do extra. No one can compensate you in what you are doing. Can we uphold the tenets? Where is our code of conduct? Can we go back there? And that takes me to the next. Health sector has become almost #1 corruption environment. Where is it coming from? And yet, all of us in the space are professionals. Where is it coming from? What is it? Is it the space in time where is it the 21st century? What is this that has allowed the entire structure of the citizens to be infiltrated by corruption? What should we do? And it starts from even admission of students. Those who are admitted to medical schools, they have stolen the exams. They cannot cope with rigorous training in medical schools, and therefore they bribe also the lecturers so that they can be given marks. This doctor, who has crooked himself from primary, secondary, in university, has known, and that is his field. He knows there is nothing that pinches him about corruption. He will continue perpetuating corruption even in his workplace. What do we do? And I want all of us to think, how are we going to eliminate corruption in our sector, in our field, in our profession? Let us stop corruption. Let us not be selling drugs. Let us not even be segregating and, discriminating. People have lined up, you are coming to call number 5, and yet number 1 has sat for 1 hour. This is corruption. Why do you misuse government facilities? Why do you steal time? All these things, if we address them, ladies and gentlemen, will make us really come back to where we were, and we shall be respected as people. So I urge all of us to seize this moment, contribute all what you think needs to be done for the sector to improve, and at the same time, let us also reflect on what might have gone wrong so that we change course and focus on the right thing. We are all here together. If I get sick now, I'll be rushed to Kapkatet Hospital. It doesn't matter whether I'm a head of public service, or I'm a Moth, or I'm Nakumicha, or I'm Kuria. First of all, you rush there. Therefore, I want to urge all of us to reflect and come together as one and transform the sector. Secondly, as we are asking for that, we are also cognizant of the fact that even remuneration is not enough in the sector. You put a lot of time, you even have a lot of risks. Even the allowances that I saw the other time that you are given and practicing allowances, some few allowances are for 1970s. Can we transform this place